I hope you have good cardiovascular health. If not, it is important to be aware of potential indicators of a potential issue with your heart. Cardiovascular disease is a leading cause of mortality, both in the United States and globally. In the United States, the American Heart Association reports that approximately 700,000 Americans die from heart disease annually. In this discussion, we will examine the 7 signs that may suggest that your heart is not functioning optimally. This presentation will be divided into 2 sections. The first section will focus on 7 visible indicators of potential heart problems, which should be carefully observed in order to identify potential issues. The second section will examine 7 classic symptoms that may be experienced when the heart is not functioning optimally. Are you or someone you know experiencing potential heart issues? In this comprehensive video, I will provide valuable tips on what to look out for to prevent heart problems and to maintain optimal cardiovascular health. Make sure to watch until the end for all the important information. I am certain that this video will provide valuable information that you may have never encountered before. By liking and sharing this video, you can help make it more widely available to those who may not have access to medical care. Please consider sharing this essential information with your friends and family to help protect their heart health. Your actions have the power to save lives. Are you aware of the 9 visible signs that may indicate a heart problem? 1. Swelling, edema. Edema, or swelling, in the legs and ankles can be caused by a variety of factors, such as a weak heart or fluid accumulation in the body. This swelling may lead to a feeling of tightness in your shoes and cause the ankles to appear puffy, similar to rising bread dough. When pressed, this swelling may also create a dimpled effect known as the pitting sign. It is common to notice increased swelling in the legs and ankles later in the day due to increased pressure in the leg veins caused by gravity. Raising the legs while lying down can help to reduce swelling. 2. Loss of hair on the legs. Hair loss on your legs, especially on your shins and thighs, could indicate peripheral artery disease, a condition characterized by blockages in the arteries of the legs. Don't ignore this warning sign. Seek medical attention to protect your cardiovascular health. Attention! If you have a blockage in the arteries of your legs, it's possible that you have blockages in other arteries throughout your body, including your coronary arteries which supply your heart with blood. Atherosclerosis is a dangerous, diffuse disease that can silently progress without any noticeable symptoms until it's advanced. Don't wait until it's too late. Take control of your health and get checked for peripheral artery disease now. Have you ever wondered why people with peripheral artery disease lose hair on their legs? It's because their hair follicles aren't getting the nutrients and oxygen they need to grow. When your arteries are clogged with fatty plaques, it can hinder blood flow and cause a range of other symptoms, like smooth, bright skin, cool skin, and thinning nails. Don't let poor circulation hold you back. Take care of your circulatory health and keep your hair, skin, and nails looking their best. It is worth noting that hair loss on the legs can be caused by factors other than peripheral artery disease. Genetic predisposition and mechanical factors such as rubbing against clothing can also contribute to hair loss. 3. Xanthelasma, deposit of cholesterol on upper eyelid. Xanthelasma is a potential sign of peripheral artery disease which is characterized by yellow plaques on the eyelid. It is typically asymptomatic and presents as a cosmetic issue, but can gradually increase in size over time. Xanthelasma is the most common type of xanthoma and is more commonly observed in middle-aged women, often appearing in the inner corner of the upper eyelid. Approximately 50% of individuals with xanthelasma have dyslipidemia, or abnormal levels of cholesterol or triglycerides in the blood. It is generally recommended for individuals with xanthomas to have their cholesterol and triglycerides levels checked through a blood test to ensure that they are within a healthy range. This is especially important for individuals who have other risk factors for heart disease, such as high blood pressure, diabetes, or a family history of cardiovascular disease. 4. Senile arcus. Have you ever noticed a white or gray ring around the outer part of your cornea? This common age-related condition is called senile arcus, also known as arcus senilis. It's caused by cholesterol deposits at the edge of the cornea and is more common in older adults, but can occur at any age. In some cases, the halo may even spread to the iris, the colorful part of the eye. Don't worry, senile arcus usually doesn't cause any symptoms and doesn't affect vision. But if you're concerned about changes in your eye health, it's always a good idea to speak with a healthcare professional. It's a common age-related condition that doesn't cause any problems with your vision and usually doesn't require treatment. However, if you're under the age of 45 and have senile arcus, it could be a sign that you have severe dyslipidemia, which means you have high cholesterol or very high triglycerides, and may be linked to an increased risk of heart disease. About 60% of people over 60 years old have it. In fact, almost everyone over the age of 80 has it. In these cases it is normal and nothing to worry about. 5. Cyanosis. Cyanosis is a bluish or purplish coloration of the skin that can be caused by low levels of oxygen in the blood. If you notice an area of your skin appearing blue or purplish when you are warm, it could be a sign of a heart or lung problem. This could be due to an artery being blocked or a lung issue such as pneumonia, emphysema, or a pulmonary embolism. Heart failure, which is when the heart cannot pump enough oxygenated blood, can also cause cyanosis. Other causes include heart defects like tetralogy of Fallot. 6. Ulcers. Did you know that if you have leg or foot ulcers that don't heal, it could be a sign of poor circulation? This could be caused by arterial insufficiency, which means that there is an obstruction in the artery that supplies blood to that area. If you have this condition, you may have difficulty walking long distances or even feel tired and sore while walking. In some cases, you may even experience cramps in your legs. Ulcers on the legs or feet are often painful, but if you have nerve damage, such as diabetic neuropathy, you may not feel any pain at all. Arterial ulcers tend to appear on the outside of the leg, particularly on the heels, toes, and typically do not bleed. The other type of ulcer is called a venous ulcer, which is the most common type and is caused by varicose veins or venous thrombosis. These ulcers usually appear on the lower part of the leg. It's important to seek medical attention if you have any type of leg or foot ulcer to determine the cause and receive proper treatment. 7. Frank's sign. Frank's sign involves examining the ears for certain indicators that may suggest the presence of blockages in the coronary or carotid arteries. Paying close attention to these signs can help you identify potential heart issues and take action to protect your cardiovascular health. Don't miss this important information. Keep watching to learn all 9 signs that you should be aware of. Did you know that a diagonal crease in the ear may be a sign of angina chest pain? This phenomenon, known as Frank's sign, was first observed by Dr. Sanders Frank in the 1970s. While the exact connection between the ear and the heart is not fully understood, some experts believe that the same factors that damage the inner lining of the arteries may also cause a crease to appear in the ear. This is just one example of the many fascinating connections between the various systems of the human body. While Frank's sign, or the presence of a diagonal crease in the ear, may be an indicator of potential heart issues, it is important to note that not everyone with this sign will necessarily have a blockage. In fact, studies have shown that among 100 individuals with this sign, approximately 30% do not have any underlying heart issues, while the remaining 70% may be at risk for coronary obstruction or carotid artery problems. Additionally, research suggests that the likelihood of Frank's sign indicating a heart issue increases with younger age. For example, a 40-year-old with this sign may be at greater risk than an 80-year-old, whose sign may simply be a result of the natural aging process. It is important to consider all of this information when assessing the potential significance of Frank's sign. 8. Systemic amyloidosis. Did you know that systemic amyloidosis, a rare disorder characterized by the accumulation of abnormal protein called amyloid in various organs and tissues throughout the body, can affect the heart? This condition can lead to the formation of small, rounded bumps called nodules in affected areas and can also affect other organ systems such as the nervous system and kidneys. If left untreated, systemic amyloidosis can lead to serious complications and even heart disease. 9. Eruptive xanthoma. If you or someone you care about has developed yellow bumps on the skin, especially on the buttocks, thighs, or upper arms, it could be a sign of eruptive xanthoma. This condition is characterized by the sudden appearance of papules, or small bumps, made up of fatty deposits called xanthoma cells. These bumps may be a sign of an underlying disorder such as high triglycerides or diabetes, both of which can increase the risk of heart disease if left untreated. While eruptive xanthoma is usually not painful, the bumps may be itchy. Are you concerned that you may have a problem with your heart? It's important to pay attention to any potential warning signs and seek medical attention if necessary. Here are 9 symptoms that may indicate a problem with your heart. But before we dive into the 9 symptoms, we want to make sure you don't miss out on any of our future videos. By hitting that like button and subscribing to our channel, you'll be able to stay up to date on all the latest medical education and potentially even save a life. So don't hesitate, hit that like button and subscribe now to ensure you don't miss a single life-saving video. 1. Shortness of breath. Are you struggling to catch your breath, especially during physical activity or exertion? This symptom, known as shortness of breath or dyspnea, may indicate a problem with your heart. If you feel excessively tired or winded with even minimal effort, it could be a sign of heart trouble. Shortness of breath that becomes worse with activity and does not improve with rest could be a serious warning sign. 2. Persistent cough. If you are experiencing a persistent cough that produces white or pink phlegm, it could be a sign of fluid in the lungs, also known as the alveoli. It is important to pay attention to this symptom and not ignore it. Persistent coughing with phlegm can be a sign of a serious underlying condition that requires medical attention. 3. Fatigue or tiredness with activity. Do you feel constantly tired and weak, struggling to complete everyday activities like shopping, climbing stairs, carrying groceries, or walking? This could be a sign that your heart is not able to pump enough blood to meet the needs of your muscles and tissues. Generalized weakness and fatigue, along with difficulty in performing everyday tasks, may indicate a problem with your heart. 4. Chest pain or discomfort. If you are experiencing chest pain, it's important to consider the possibility of a heart problem. While it may be tempting to dismiss the pain as muscle strain or something less serious, it's important to rule out more serious causes. Heart pain, also known as angina, is characterized by chest pain or discomfort that lasts for more than a few minutes. This pain may come and go, and may feel like pressure, heaviness, tightness, or burning. It may also radiate to other parts of the body, such as the left arm, neck, back, jaw, or stomach. 5. Palpitations or irregular heartbeat. Palpitations are a sensation of a rapid or irregular heartbeat and can be a sign of a heart problem. Some possible causes of palpitations include abnormal heart rhythms, heart problems that affect the heart's ability to pump blood effectively, and other conditions that affect the heart. 6. Swelling in the ankles, feet, or legs. Swelling in the ankles, also known as edema, may be a sign of right-sided heart failure. This type of heart failure occurs when the right side of the heart is unable to pump blood effectively to the lungs, causing fluid to accumulate in the lower extremities and leading to swelling in the ankles. In addition to heart disease, other potential causes of ankle swelling include kidney or liver disease, venous insufficiency, a condition in which the veins in the legs do not properly circulate blood back to the heart, and certain medications. 7. Dizziness or lightheadedness. If the heart is not functioning properly, it may not be able to pump enough blood to meet the body's needs, resulting in low blood pressure, hypotension, and insufficient blood flow to the brain. 8. Cold sweats or clammy skin. If you are experiencing cold sweats, it could be a sign of a heart problem. When the heart is not working well, it may not be able to pump enough blood for the body's needs, causing low blood pressure and a drop in body temperature. This can lead to cold sweats, which may also be a sign of other heart conditions like a heart attack or angina. 9. Intermittent claudication. If you experience pain in your calf muscles while walking, especially after only a few meters and that improves when you stop, you may have a condition called intermittent claudication. This is caused by poor circulation in the legs, which means that the blood is not flowing properly to the muscles in the calves. The pain typically occurs with physical activity and improves when you rest. If you think you have a heart problem and have noticed any of the warning signs or symptoms, it's time to see a doctor. Don't ignore these warning signs, they could be a sign of an underlying heart issue that requires immediate medical attention. Thanks for watching. If you liked the video, hit subscribe to see more. Your support helps us make more great content. Thanks again, and see you in the next one.